Back, everybody, for part 2 of PEMF and pain. So as promised, this week we're going to be reviewing a new study, also related to pain, but this time it's going to be about back pain. The reason that I picked this one is back pain is a major source of pain. In fact, 4 to 5 people will experience it in their lifetime at some point, and a lot of people will actually become disabled as a result of this. So again, to review from last week, the pain can be acute, which means an injury that's just happened, like spraining an ankle, or it can be chronic from some kind of a disease condition. It can be specific, which means it's being identified by some reason, or it's non-specific. There's not really a known cause for what the pain is generated from. So this is the most common neuromuscular skeletal condition. So that's just meaning that's affecting the muscles, your nerves, your bones, and the tendons can all be in play. We traditionally treat this, we're told to rest it. After some period of rest, there might be physical therapy, surgery if something is found that is actually a problem, and then the non-steroidal anti-inflammatory medications. So this kind of back pain you find from just strains, maybe lifting something heavy. It could be a disc issue, could be caused by a disease. So maybe you have fibromyalgia, maybe there's arthritis, lupus. It can be structural. So you see this in people that are actually born with sclerosis or some other issue, which is there's a malformed spinal cord. It can be exacerbated by people's weight. And I think this is also true of mental health as well. A lot of times, if you have a lot of stress or anxiety, it can show up as back pain. Age can also affect it, as well as your lifestyle. So people that have jobs maybe that overuse their back, or maybe people who are doing sports or some other reason that they can become injured. So the pain can come as sharp and sudden, as in acute injuries, or even just pain that just kind of is transient, it comes and goes, or it can be a constant type of pain that you feel all the time, that may be made worse by overuse or for other issues. So the study that we're looking at today was about the effect of pulsed electromagnetic field on nonspecific low back pain. It was a randomized controlled trial. So this was conducted by some researchers in Cairo, Egypt, and there's a link here to the study if you want to review all of the details. So design was that it was a prospective, randomized, patient-blinded controlled trial. So this one wasn't a double-blinded. Only the patients didn't know which group they were in, but the researchers did. Participants included 50 patients. They all had nonspecific lower back pain, and they were enrolled either in an experimental group or the control group. So the intervention given in this one was half of the group was giving conventional physiotherapy treatment as their protocol, along with pulsed electromagnetic field therapy. And then the control group was giving the conventional physical therapy treatment, but then it was a sham electromagnetic field group. So they received 12 sessions, so it was 3 a week over a 4-week period. I just want to note at the bottom here, some of the details that were included in the study was they did use 50 Gauss for the PEMF at a 50 Hertz range, and they were doing 20-minute sessions 3 times a week. Added on to the conventional physical therapy, not only did they make a routine that was based on the individual needs assessed by each patient, but they were also giving TENS, which is, for those of you that don't know, it's not PEMF because there's no magnetic field. It's just an electrical current that's placed through a pad onto a specific area of the body. And these are used commonly in physiotherapy, as well as ultrasound, which is a lower hertz, only 1 hertz. They used it for 5 minutes. And this is like a solid sound wave that goes into the tissue. So the outcome measures on this, the primary one was the intensity of the pain, and this was the same as our last study that was done in the C-section. It was based on a visual analog score. This one included as a secondary outcome measure disability and lumbar range motion. So lumbar is, for those of you that don't know, it is the after your cervical neck curves and then your thoracic curves. The lumbar is the lower part in which you would like flex backwards and forwards from. That's where a lot of people end up with lower back pain. So they were measuring that disability and then the range of motion at the lumbar area. So the results of this were of the 50 participants with the non-specific lower back pain, the control group being 25, and it was experimental group 25, and they did split it pretty evenly between male and female. So there was a significant difference between the pain scores. So this was the primary measure. So when we look at this, we have a mean difference of 1.52. So that is quite significant. And then the functional disability score was also significant in this case as well, 8.14. And the range of motion of the lumbar flexion. So this one we seen as it was still significant, but it was less for the extension and the flexion of the lumbar. Now, I would say the reason for this is I also am a certified yoga teacher. So I do a lot of work with people in their spine. When you're flexing forwards and backwards, there's less range of motion there in your spine. So the difference between where you would start and where you would end up in either group is not going to be as significant due to the limitations of moving that part of your body. But when you see the range of motion for the lumbar side, for the right and left, which how they measured this one was when you stand with your fingertips down, they would have you bend one direction and the other, and then measure the distance between your floor and the finger. This one you've seen more of a significant change because there is more range possible. So both groups seen a change, the control and the experimental, but the PEMF group seen a bigger range. And just as a side note then, for the flexion and extension, they measured this by drawing marks on a back between two locations and then having people either flex forward or extend back and then remeasuring what those dots move to measured on the back. So you can see here that the results were really good for this study in favor of PEMF. So conclusion was that adding pulsed electromagnetic field to conventional physical therapy protocols yielded superior clinical improvements in pain, functional disability, and lumbar range of motion in patients with non-specific low back pain more than conventional physical therapy alone. But I do want you to know that they did continue to use all the standard treatments, and they just added PEMF on as another layer. So this slide, for those of you that watched the first part on pain, I left this slide exactly the same, and you can review it more in detail when I discuss it in the previous video, because really nothing changes here because, well, like I talked about then, whether the pain comes from an acute injury or whether this is from a chronic condition, it really doesn't matter because the mechanisms of pain and the mechanism of PEMF work equally on all areas. So you can find relief to your pain. So there were no adverse events reported in either of the studies, the one on C-section or the one we reviewed today. And I have been studying PEMF and studies for a long time, and I have yet to find actually any study that had any adverse effects. I'm not saying that there hasn't been, but I haven't come across any. So it is considered safe. It is non-invasive. And you can use it along with your current approach. As we've seen in this study, they were still doing physiotherapy. They were still using a TENS machine, ultrasound, and anyone that maybe was using any of their medication, they could still continue to. PEMF doesn't exclude any of the other things. So it aids in cellular performance and detoxification. So if you are using medication, you can metabolize this better and it'll become more effective. It also increases your physical performance. So you have more energy and voltage in your cell. This allows you to perform all of the physiotherapy routines probably more efficiently and more effectively. So PEMF is widely used by chiropractors. So you find that a lot in their offices because they're aware of how this can affect the alignments that they're doing onto people, and any rehab routines that they're sending people home with. Acupuncture also works with the same meridian and energy system as PEMF. So I've heard it be said in books that I've read that acupuncture, when you use PEMF, it's kind of like lighting up all of the acupuncture points all at the same time if you're using a full body mat or whatever ones fall in a specific applicator of the area. So they work really well together too, and very similar mechanisms. PEMF also works for reducing depression, anxiety, and stress, and it does help actually to sleep better too. So I would argue that seeing as back pain has a lot of times an emotional or mental component to it, and even just if you want to say that the pain didn't come from that, it was an injury, the pain itself is something that makes it hard to sleep and gives us anxiety and worries. It's hard to feel pain all day. So either, which one came first, the pain or the anxiety or the pain, either way, PEMF works on this mechanism as well. So if you're going to benefit one, you benefit the other. So I picked this particular study today because the first person that I treated with my PEMF machine outside of my family was actually a neighbor who had non-disclosed back pain. And she wasn't sure why she had it. She was suffering a lot of stress. She's a busy person, running around, doing a lot of things. And after she started to experience the pain, she did the normal things, which was resting it, was icing it. After that didn't go away, she took pain medication for it, still not helping. She then went to the doctor. They did do scans on her, an MRI. They did x-ray. They didn't find anything that was wrong with her. So I did, after talking to her, really strongly suggest that she come over and let me treat her. Not only did I treat her on my more powerful machine, which was much stronger than in this study where they're only, again, using 20 Gauss. I'm thinking more I treated her starting at about 2,000 and working up to 4,000. But I only did one treatment on the big machine. But I did send her home with a portable plug-in machine that does have 200 Gauss. Now, she, within days, like the next night, she told me that was the best she had ever slept. First time that she didn't have to be, she had to be woken up by an alarm because she kept sleeping through it. And within a couple of days, she called back again to return my portable machine to me and let me know that she didn't need it anymore, that she was totally fine. And I've talked to her again a few times since, and the pain's never occurred. So even though we're not sure what caused it, we do know what resolved the pain in the end for her. So I was really happy to provide that for her. And I just want to give that to you, outside of just this study, my own personal experience, that it is possible to resolve the pain, and there's no reason to keep suffering. So I hope that you found this useful. Subscribe, please, to get future notifications for more videos that will come out. And also check me out at energyovermatter.com. You'll find lots of great information there. I do offer yoga and meditation as well. So anybody that's looking for help outside of just PEMF, feel free to reach out to me for that as well. Have a great day. Be blessed.